All right. Good morning, everyone, and thank you for being here. Do you guys want to actually introduce yourselves, though? Because our colleague, I'm Susie Bentley. I am all the things that it says up there. So I am an emergency medicine doc at Elmhurst in New York City, turned chief wellness officer, and run clinical event debriefing, basically, for our hospital system. So do a lot of this and think deeply about this, way too much about this. But that's kind of something I'm super excited about. That's my like nerdy passion. And that's it. And I'm a simulation person and wellness. So I bridge the worlds between formal event debriefing and quality and safety, which is my background, and then well-being and diffusing, emotional processing. Take it away, Tina. But our colleague in blue does not know you.
Oh, I'm sorry. I'm from
Amanda is ill and extra thankfully sleeping, so she doesn't get everyone else sick. Tiff. Yay. Do you want to introduce yourself, Cindy?
I'm Cindy Witter, and I am at St. Louis University.
I'm Gina. I'm a medical student. I'm at University of Rochester.
Awesome. Great. Disclosures. We wish that we did. The objectives are to talk about clinical event debriefing, why it's important, why it should be used for quality, safety, and wellness, and then looking at key components of starting a program and potential challenges, which will be interesting because we can frame it around what hasn't worked, and then really two concrete things that perhaps we'll all do when we get home. So I'm curious to ask you, if I can call on you, what comes to mind when you think about debriefing?
I guess gathering as a group and kind of going over events that took place and how people feel if it was something that was upsetting. I'm thinking in terms of like seeing a trauma, but I know it's not specific to that. Yeah.
Great. And do you think, is this being done a lot, would you say, or regularly when you've rotated, not just even in the ED, but anywhere?
Not really, honestly.
Yeah.
I think it would be great in the ED specifically because I have an EM clerkship that I did. I think it would be good to have someone there.
Yeah. I'm yet to find anyone that really confidently says that it's happening regularly, which is part of why we're doing this. So if I told you that this was all debriefing, would you say you did it regularly? So broadening debriefing to think of it as just a reflective conversation. I usually put this up here, the term that the kids taught me, the residents, is really like tea briefing. So anytime you go to the bar after a shift and you're like, we're not going to talk about work, and then all you talk about is work, that processing and need to talk through things and what's sticking with you with a friend, whoever your safe listeners are, is actually all debriefing. Not obviously formal the way we're talking about it now, but people do this just innately. It's kind of a need, I think, that drives all of us, and something that we do more than we realize. We just don't necessarily do it formally. So this is what the AHRQ tells you that debriefing is. It's really a dialogue. And again, much like, well, you said, although you said too about emotional support, the AHRQ really is focused on the quality safety aspects, so looking at actions and all about improving future performance. I personally like this framework better, which is really work is done. So there's focus groups, we get feedback from staff, we all have surveys, there's metrics, and then we write policies, right? And everyone that's sitting in their comfy offices think that that's how care is getting delivered, but then when shit hits the fan, that translates into actually work is done, right? So when you're short-staffed and you're under-resourced and you're just making it work and you have 3 traumas at the same time and all the things that, are perfect don't necessarily happen, but you get it done and you get it done well, that's kind of work is done. And that's really the unique power of debriefing, is looking at that, because you're actually debriefing after the work, as opposed to, theoretical outside of the real space. So my burning platform and how I ended up in the C-suite doing wellness was from the quality and safety lens. But I am obviously not a psychiatrist. That's why I'm at this EM conference. So I joke I'm the proverbial peer. But really the hidden agenda, and I think the big benefit of wellness, of debriefing, is and should be wellness. But it's something that most programs don't include, which drives me crazy. And I'll say for the SIM, so the four of us are linked in the SIM Academy and all have simulation backgrounds. Most of the frameworks talk about a reactions phase, because everyone quotes this one study that says you need to clear emotions in order for people to be able to analyze events. And no one in this room, I'm sure, does it this way, but most people are like, okay, how's everybody feel? Because that's what you're supposed to say. It's like scripted. And then people will be like, I feel horrible. I feel scared. I feel whatever word. And then everyone's like, great, okay, we did reactions. So someone summarized the case. And I actually think we do a lot of harm in the current debriefing structures that we have, because it exists, but it's actually, I think it would be better to not even acknowledge or ask the question if we're gonna not pay any sort of honor to the actual sharing that people have. So that's kind of, again, where this talk was born from and how I think we can do better. Other thing I'll say that I run into a lot is some people want to just do one and some people want to just do the other. So that's great and fine, and everybody should just debrief however, but I personally think, in my experience, and I'm curious what you guys think, is that some people have to talk about the emotion before they can process the event, but also, especially in EM, a lot of people, if you sat down, so I run our peer support program, so we'll sit down to talk about how they're doing, how they're feeling, what they need, how they're coping. And a lot of those people, there are a lot of people that are like, okay, I don't want to talk about that. I want to talk about the case. And I think, I don't know which side I err on, but probably more that way. I think a lot of people heal by being able to actually talk through the medicine and the what ifs and get through all the things that they wish they did differently, or they're not sure if something could have changed the outcome. The answer is almost always it would have never changed. But the point is you need to be flexible, and I think you need to be able to do all of them to really safely and responsibly debrief. So diffusing, which is a newer word, most of us would say this is debriefing for emotional support. Doesn't matter what you call it, but is a well-being practice, and really term talking it out is the most easy way to think about it. But this is after the event happens, really allowing for emotional processing, a safe environment. I think this is also kind of the secret weapon to normalizing, talking about how hard it is to practice medicine. And often this can be kind of the entree into doing formal debriefing and then actually looking at what's better, or what could be better. So again, I just want to challenge you guys to think about clinical debriefing as both debriefing and diffusing, because while we want to pick up all the safety threats and things like that, most cases, many cases, actually a lot more of the power of what you can get out of this is not necessarily what you can learn from it, but how we can normalize talking about things and how we can actually use it as a change agent to really encourage speaking up, culture of safety, teamwork, and morale building. So benefits, we kind of talked about them. So we did a similar talk at the IHI, and we actually asked people to write in what do they think the benefits were, what did they think the objectives were. It's kind of hilarious doing this because you guys, we've all talked about this, but most people would say, if they didn't already see the intro, because I've primed you, the benefits are really around improving quality and improving safety. And almost across the board, that's what people say. And that's true. And the AHA, they say that we should be doing it, and not just in EM, but in all of the specialties. There's great studies that actually improves clinical outcomes, and that's awesome, right? And that's ultimately the holy grail metric. But that's what we want to do. But people really, really, really underestimate and undervalue and don't talk as much about the benefits of debriefing. If you do it with an intentional focus on emotional wellness, there's studies that really show the worker improvement. And I put that up there, right, because we always talk about quality improvement and patient safety and performance improvement, but let's talk about worker improvement. So all of these are or benefits and side effects, I guess. So the barriers, and Cindy started hitting on a few of these, and I think everybody kind of knows these. These are all really, really true, right? But with a little bit of forethought and planning, you actually can get around a lot of them, and that's why we were doing this talk. So the 10 key considerations are really things to think about before you start your debriefing program to help you proactively address a lot of these and get ahead of a lot of these so that you don't run into them. So I'm gonna hand it off to Tiffany. So we're gonna go through these in warp speed, and then we're gonna workshop a case.
Okay, sounds good. So who are your key stakeholders that you need to engage and why, and how to best engage them? So think about whose buy-in and engagement is needed and in what way you would want to collaborate with these individuals. So some stakeholders are more important in some ways than others. So it's important to consider the influence, resources, and power that each stakeholder or stakeholder group will bring to the table as you start to navigate engagement. You may need somebody to give you approval to begin the program, or a partner to promote the program, or someone to collaborate with to help with execution. So you're going to want to engage key leadership from the top down to the frontline staff. And this can include institutional leaders, physician leaders, nursing leaders, people from other departments if your initiative is interdisciplinary. And with your stakeholders, you're going to explain to them your why or your specific objectives for starting this program, but you're also going to try to engage them by trying to satisfy their why or how they could benefit from starting a program. Some additional stakeholders would include risk management, as they could help to guide document development and to ensure the findings collected are properly protected from liability or discoverability, quality and patient safety, and regulatory services. And these particular stakeholders are best positioned to shed light on the high-stakes issues and priorities to the institution, and they can tell you about any related initiatives that already exist at your institution. It would be important to meet with them in order to collaborate and to figure out how to best integrate your collective efforts to best meet institutional needs and objectives by creating a clinical event debriefing program. And by learning your stakeholders' whys of why a clinical event debriefing program is aligned with some of their objectives, you can then move to the how or how to best engage them. So how does the debriefing program align with the existing programming goals and objectives at your institution? So the why and benefit of both sides will help to inform the how or the best approach. All of these stakeholders may be best positioned to shed light on the highest stakes issues and priorities to the institution, the existing initiatives, and how to collaborate to best inform the alignment of a new debriefing program with the existing initiatives of the institution. So you may ask, are there specific hospital departments or areas of your hospital that have some poor metrics or measures that could be focused on in order to learn more? For example, you might learn about a high-risk incident type or a procedure that's happening in your hospital. Are there specific metrics being collected that debriefing may help to better determine the underlying causes of these events? Is there a new quality initiative or a new PI focus? And how will you be sure that this focus aligns or is a priority? This will require an honest discussion with your stakeholders. So ask them about what the pain points and the most pressing issues are for them, and by doing this, you may be able to find a middle ground. This was Amanda, I think, but it's easy, I guess, to take over.
Amanda's not here. So I think we covered almost all of this. So biggest thing, not surprising, kind of like I said, was really how are you going to intentionally have objectives and goals that cross all three domains. So again, quality, patient safety, looking a lot around clinical metrics. Then there's some programs that really are just focused on workforce wellness, and then really how do we bridge the gaps. And obviously, whenever you do diffusing or wellness or peer support, you're always closing with professional resources, because that's really the power of that is being the conduit into it. So I challenge you to think of why are we not doing this in all of our clinical event debriefings? And it can be as easy as just this example, which was largely kind of bridging the worlds, which was using a lot of the safe container language. really from SIM, but much more in reactions to do it in a meaningful way, including giving people permission to not talk about the case itself that day if it's too traumatic and it's not the right time to actually go through the analysis. And then if 100% of the time we acknowledge that cases are hard for different reasons and give people support, we just broke through a lot of the stigma of supporting people by making it so normal that that's what it is. It's all hard, and here are the resources every single time, so that the time that someone needs it, when you're not sure and you're unable to guess, you actually have done it, because that becomes your culture. So no one right way to debrief. These are kind of the common steps we see with debriefing, but as we're trying to meld these objectives, it can be as easy as, how do we really normalize the debriefing? How do we talk about the emotional aspects up front and acknowledge it can be hard to talk about? And then again, with the how do we end with support resources 100% of the time. I think it's Tina.
Hello, I'm going to be talking a little bit more about some additional aspects of debriefing. So as we just discussed, clinical event debriefing programs have a range of possible goals depending on the institution and the environment that they're developed for. So we work in an interprofessional environment. It might make sense to look for debriefing champions in a professional sense. There are lots of examples of successful clinical debriefing programs led by non-physicians who also have expertise and source credibility in the environment that the debriefing program is taking place in. And once you've identified these valuable champions, you can position them to succeed by aligning them with the goals and objectives of the clinical event debriefing program and developing or co-developing the tools and the scripts that they'll need to lead a debrief. Psychological safety. So psychological safety is challenging at the best of times, but it might be particularly challenging in clinical event debriefing because intrinsically these are real teams taking care of real patients in live clinical situations with real stakes. There are a range of strategies to enhance psychological safety. Some are verbal, some are nonverbal. I think that these have been discussed quite a bit, but implementation is incredibly challenging. Like any other skill in life, being able to effectively create an environment of psychological safety, it's a skill that needs to be intentionally practiced. You need to get feedback on it. So my take on this is that when you're building a clinical event debriefing program, that might entail providing development opportunities for the debriefers who are recruited. It might entail giving them opportunities for intentional practice, and might also entail giving them opportunities for feedback, because in the absence of that, it's going to be very difficult to establish this culture. So what clinical event should be debriefed to start? So this is going to be very, very environmental, and it's going to be very local to the goals and objectives of the program that are being developed. One of the things I do want to point out is that every clinical debriefing program, every instance of clinical debriefing, clinical event debriefing, it costs something, right? And what I mean by that is it's a high resource program. It costs some degree of time from the faculty, from the participants, from the work you put in, which Sal will talk more about collecting and analyzing the outcomes from it. So I think it's important to be very, very thoughtful and think about what events best align with the goals and objectives of the program. And with that, I'm going to hand it off to Sal.
Okay. So the next couple slides are about data collection and reporting out what you're actually doing as part of your SIM program. This bit is determining ahead of time who's collecting the data, what it's being used for, where you're storing it, and how often it's being reviewed. And I feel that a lot of this ends up becoming determinant on what institution you're at. So if you're at a place that, for example, has a Office 365 enterprise subscription for everybody, you might find that the simplest route is an Excel spreadsheet on your Teams channel that everyone can use. It's already encrypted. It already follows all the institutional protocols. And so I think it can be as simple as a shared Excel sheet. I think it can get as complicated as fleshing out SIM captured all of its abilities. And it's just a matter of what you're trying to use it for. Plus Delta debriefing is a pretty simple but very powerful form of debriefing. And the idea here is that you can collect data to be reported as potential actions or actionable outcomes to change based on the sections in the Delta. So chaotic, too many residents, didn't defibrillate. You can turn these into themes and areas of improvement that you can then share with your stakeholders as actions that can be improved. I see this best being used in situ simulations at my own facility when we have like multiple trauma and OB or EM, being able to take these and turn them into actions and then send them out as like latent safety threat reports is one of the ways that we really kind of show our value at IU. Obviously, I don't think you have to do every one of these measures when you're doing your SIM, your debriefing. It's a matter of finding out what your shareholders themselves value. At IU, for example, it's all about the major shareholders are IU Health, the School of Medicine, and the School of Nursing. And it's a very high volume place. And so a lot of IU's metrics that they'll share out, that they'll collect, will be things will be process oriented measures. There'll be the number of cases, there'll be the number of people they'll be able to brag. Like we did XYZ 1,000 people in our SIM center this year, wow. You may find that if you're at a for-profit SIM center like Ascension across the street from us in our same city, they tend to be a lot more focused on how many ACLS training rounds did we do, how many ATLS events did we host. So it's a matter of understanding what your stakeholders, what your bean counters, what your administration actually values out of you, in order to be able to feed that back to them and then kind of perpetuate that ongoing investment in your own program. My last bit here is about closed loop debriefing. You want to be able to give actionable outcomes and improvements and feedback to your stakeholders, but at the same time, you want to be able to share how you're doing and what's working and what isn't with the staff around you. It improves their own buy-in. It gets people more invested in what you're doing. It builds morale among the people that you work with. And that's what closed loop debriefing is, essentially. Sharing the positives, sharing the areas that need improvement with your techs, with your SPs, with the admin, with just the support structure that you've built around you. It's how you maintain a more cohesive group going forward. Small group activity time. Okay, we're gonna break into groups of 4 or 5.
Why don't we just turn these around and make a circle? Or over there, make a circle, but everyone go to the same spot. Oh, my telephone. So our plan was to start a clinical event debriefing program focused on trauma scene activations. Because your stakeholders have told you, or volunteered you to do that. Because collaboration's been really important, communication's been really bad, and you're missing critical elements in evaluation. So like we talked about, there's 10 key considerations which were on the second page, which we're going to focus on the ones that are bolded and pick a couple to talk about really how would you go about setting up a program. So who might the stakeholder be, and most importantly, why? What do you need from them? What's the ask?
So we had residency program leadership. Surgery /
doing a few of them and actually looking and analyzing what is happening can help you to, I mean, we all have the exact same thoughts around radiology and things like that, but to see kind of what more issues are. And remembering that you can grab people and essentially do exactly this, even if it's not directly after a case, which I understand would be, say, the actual work extent or backup instead of work as imagined. Totally.
I love that work is done versus work is imagined. I love it. The no records. And then you use your research skills.
Right.
Yeah, our group had to do a root cause analysis for this one. There was like a sentinel event at Brighton Children's where there was like a really horrible NBC trauma with a lot of chest trauma, and the placement of the chest tube was just an absolute mess. And the trauma director contacted the IUCM division and was like, we want training for the residents to be able to put chest tubes, which wasn't the problem at all. The residents knew how to put chest tubes. It's just that the residents were screaming at the nurses trying to get them to, get all these equipment and these, different tools that they hadn't practiced actually getting before and didn't really know how to get. And they panicked, and so they were, their communication was all over the map, all over the place. And so we had to do like the root cause analysis to be able to kind of come back to that trauma director and be like, let's deal with communication as the problem, not just replacement.
Did you do Sims to do your RCA?
Yeah. Yeah, I think that in part that was dance side.
And also, as we're kind of talking through this, so you guys like brought up radiology, but also when we're doing radiology and that's understand what their perspectives are on what's not working, because we see our side of it, but don't necessarily know what they're up against. So making them feel like they're a valuable stakeholder and not in trouble, but included because you really want to help work together and include them. You suddenly have their buy-in also to participate, right? Because at the end of the day, they probably want to make it better too. They all think that we suck as much as we do they suck, right? Everybody thinks everyone else is the problem. Anyone else, as you're setting up a program, thinking a little more global that you might partner with or bring in as stakeholders?
I agree. I think that a lot of times when the people in the setting programs of people that needs to be this often testing right now, and it's so important. So one example of we're setting up a peer assessment process for our students because we is that we want to have a professional development where we're having guidance students who can do peer assessment with us so that they can tell us what we're doing with the data that's found. But I think that's one of the ways in which involvement stakeholders involvement process can be really important in terms of ensuring that
Yeah. And it's a double-edged sword, right? Because you're ensuring that, and you're ensuring their buy-in, but then ultimately you're making it our debriefing initiative, right? Instead of my debriefing initiative, and suddenly they have some skin in the game to, have to participate, and and then I will just say, and obviously I have a little more of the hospital lens, but I think a real reason that a lot of programs don't reach sustainability is because we think very local. But risk management and the quality teams are actually amazingly invested in this and often can take that RCA and look at all the other RCAs to see whether or not, there's a theme in how certain cases are going. And then it cuts out a lot of your need to do your own data gathering because they can actually put some information and metrics behind it. And then the big thing I'll just say with stakeholders that I always say to like, who is our stakeholder? And it'll be different people, is figuring out who's committing to fix whatever you find. Because you're committing to debrief it, and you'll pick up all the latent safety threats, and you'll figure out all the problems, but that doesn't mean that you have to fix them all. And I think a lot of people that don't do that step then end up with whatever, like Sal talked about, how you want to capture the data. It's great to capture the data, but we're not just looking to publish it, although that's fun. Right? We're actually capturing that data to make things better and make things safer. So who's actually going to commit to taking that? So at our institution, all of our clinical debriefing actually focus PI, because the right stakeholders do that in that meeting at the table, and everybody is on board with, okay, this is like the team over me, and who's going to fix what, and then that's where those filter back to the fix. Because then suddenly they don't hate you as much. Well, for rather than taking their time to debrief, because they actually like realize the volume's there and stuff like this. I think that I would perpetuate it too, because that's something I'm perpetuating for how little we do that. And you gotta think, like, even if you're just doing it in the end, even if you're just doing it for docs in the end, like everything's part of that other plan, so don't forget that one. All right. What would your objectives be? So here you have this trauma case. So goals, right, are what you focus on. They're like kind of your overarching reason. I'd say the goal of debriefing is always to analyze and learn from events, right? If we're talking one of them, but if, you know, the actual objectives are more like what is the metric you're trying to impact. So are you trying to look at test tube completion time? You know, are you trying for trauma to look at, you know, time to the handoff when the surgeon show up, whatever it may be. And the quality of safety ones are always like a little bit more obvious, but then how could you add a focus on wellness and staff debriefing staff support? What would you do? Or what would the thought exercise be proactively before you were in the department?
It's built into something else. So people actually have like as a staff, it's part of all this stuff.
So picking a tool, not right, not like making your own, actually coming using any of the validated tools that are already exist in the way. And that goes back to stakeholders too, right? So like, so you're going to give resources who's all learn out 100% of the time to people to get support after. So who else do you need to partner with? You need to partner with whoever's going to start getting more calls or more referrals, right? Your employee assistance program, your peer support program, whatever it is. They need to be bought in on it also, especially if that's something that's not already like put into your institution. How are you going to flex what you learn? How will you use it?
We ended up having to get IT involved for our current stage in this project. It's fun because before we get to like the ultimate goal will be doing insights specific and debriefing on communication and trauma day. But before we do that, we've been collecting or we've been evaluating trauma that come in throughout the year and going through like the video footage because all our trauma bases are like wired cameras and just being able to get all of our investigators access to those cameras took like months, you know, to do. So IT, like local IT was huge in helping us get access. So now we're at that stage where like where we independently at home reviews of it and then ready to enter data. That was like
So I would say like at the most basic level, you can do it on a sheet of paper, right? But then like, again, if you're actually committing to anything from it, it's where the sheet of paper comes. I think the easiest is to do QR code on the wall. So do a little box so you can have the tool, but then in theory, if you want to go out there and report something back, you know, and then again, who's bought into it, so it's not just all on the computer, so you have to do something with it. So that's where things evolve. And all of ours go to quality managers. Data entry is
Mine there is building in the time that you're debriefing for people to give feedback. Like I didn't do that for the first couple of projects that I was independently doing. And then so you're at the end where you're like putting up a QR code at the end and you're
Oh,
leaving, you know?
got it. No, I actually mean the debriefer to like enter in like if you can put self, like what you learned from it.
What you're actually.
Yeah, not actually, yes. I mean, you could
Not
do that
getting
with participants themselves, but no, I mean literally like the nuts and bolts of like, you identify some equipment's not stopped. And you can get that to someone that's in
Where you're
fix it.
writing it
What's your
down.
system? Yeah, exactly. I think you can do a lot of harm getting people to take their time to debrief with you if you then don't do anything with it. They're never going to want to debrief with you then. Right? I wouldn't either. You know, the next day the same exact issue happens and things like that. So what's the point of that program? Yeah. And then measures of program success. Split over really totally your objectives. Right? So it's, yeah, I would say these really, really evolve. I think another pitfall that I see a lot is people set up beautiful comprehensive programs up front. Like it takes a lot. It takes a lot of buy-in. Like your goal for the first number of debriefings needs to be just to have the debriefing and have people there. And that, if that's a process, might be that fine, right? But if you're at it for a year, it starts to get, I don't know if embarrassing is the right word, but not so effective when all you have to put out on is just what's happening. Right? You want to like evolve to actually be using them to change something at some point. But that doesn't have to be day one. And I'd also say staying really flexible on this, because you'll end up learning a lot from what your assumptions are about what you want to actually capture.
Just to think about, because I think that you're absolutely right in terms of a lot of people that it's here to prove that it's on quality. If you want to work in a wellness objective, you have to have somebody who looks at that wellness objective, you know, what kind of living, it's not a wellness objective, and it has to go somewhere that that's actionable, right? You know, because when it's not it's very tough as a sort of programs
Yeah.
when people participate in these groups that take time to accomplish some things.
Yeah.
You know, that's
I would tell you for wellness, I would look a lot at process measures. Another big pitfall, I think that you are successful if you incorporate it in your debriefing, like an intentional focus on it. And you can look at the number of referrals, you can even look at the number of resources you've given out. For wellness in particular, because I get asked this all the time, you never want to take, this is for wellness in general, but the ownership that you're going to do anything with your one-off debriefings, it's going to change. You're not changing burnout scores alone with debriefing, right? You're not changing people not calling out sick or any of the other things that administration loves, right? When they think wellness, they think lost productivity and, right, and hard scores. So you may make someone less anxious, right, or other things in that moment, but just unless you're God with your very frequent debriefings after a certain case. You know, I'm just saying, like, be realistic. I think wellness is a lot harder to measure, and it ends up being a lot more around the culture change. We're a place where when you debrief, the first thing you worry about is how you are as a human being. Then we talk about what to do better. And again, that falls into process measure, and people get frustrated. But your debriefing is probably not, I mean, I hope you're going to be so successful that you single-handedly with that are going to say you change something. So when I see these studies where they're like, we did these debriefings and burnout scores improved, I'm like, that's not from your debriefing. You know, it's like highly confounded. Because if it was that easy, everybody would do well and we'd all be debriefing, right? So it's a very interesting, like I said, I think it's just that is what keeps me up at night, because if that was easier to prove, I think it would self-perpetuate. But again, most of us are very much so to see people celebrate if you just get people to value it and not to intentionally do it. So
For those, is there any value in collecting like participant free response feedback and then like collating it? Like, is there?
I would leave that to your discretion. Every kind of like project you see, that's what they tend to do. Sometimes they even survey people before and after. I would say with my wellness lens on, I think you are probably bringing people out asking them to do a survey on wellness before and after debriefing. So unless it's like for a very specific reason, I wouldn't bother. I think if you're trying to embed it in culture and practice, it takes so long to do it. It's like, I almost think that you like more groups start asking you. Now that you've been vulnerable, you've processed this, you've stepped away from your patient, especially these are clinical events. If it's SIM, it's different. Because they're there, right? They're already hopefully protected to be there. But I think for clinical events, when the whole ED is on fire in the background, and you're like, but this is important, let's do it, to then be like, take 5 more minutes could be in New York, people when we're rooting there, so that could be our culture. I think like I would just have to be so convinced of what I would learn from getting it that I probably wouldn't. Or if I did, I would probably do it like here's a survey of it, have you participated in it? Yes, no, and if yes, then you can also figure out benefit, things like that. I would probably do it. But again, that's just one opinion. But I always think like, would you want to take 5 minutes to do a survey? It's hard enough to get people to take, 10 minutes. And again, these are happening in 10 minutes or less, right after bedside, and another trauma doesn't come in the same time, so. Yeah.
Yeah, I think whatever you get in that like 5 minutes after is gonna be so, like, you would wanna look at once a month, how is our relationship?
Yeah.
Other than better, as opposed to like, right after everyone's freaked out and something like happens, and then they're all like, talk about it, feelings,
And then closing the loop, I think, it's all been on entirely in slides. But right, if you're gonna fix something, how are you gonna tell people? Right, so the people that participated, everyone that didn't, but then sees that email or hears it at a department attending meeting, whatever it might be, and they're like, oh damn, something actually is coming out of this. Maybe the next time so-and-so wants to do it, there is some reason, because that's really, I think, how you perpetuate the value and the buy-in. And if you're fixing things because of it, it's really like taking you in and celebrating. I put on the bottom, like having a celebration, where we legitimately had cake in the ED after however many debriefings, especially when we were starting, because it seems so sweet that people love cake, number one, but then they're like, oh wow, like it's actually not a one-off, right? It's not going away. This woman's actually here with cake because we've done
happens like
50, whatever.
small measure of positive value. It
Yeah.
makes change my plan, right? It makes change my plan when I go to work in a sense.
Yeah.
That's when the part of the visual actually played.
Did you bring me the cake?
The cake bit,
The
more like
cake,
the
yes.
promotion, the celebration.
Oh,
aspect
yeah.
of it,
That's, no, that is really true.
It means a whole lot more when like the higher ups are also like.
Yeah.
exponential.
And maybe get them to announce it at the attending meeting, like when it's stuff that, like with the shout out to you, like Sal's debriefing program has identified this, we want to let you know, we changed this workflow, we use that, whatever. But so it shows that you're sharing and paying upward, and that they're invested in fixing it too. And I often usually say it quite like that, but like, tell me all of the things that you want so-and-so to know, because this is the time, so I'm gonna write them down, and they promise they'll fix them. So share the pain of you doing the work here, kind of like with me now, because I promise that it'll get fixed. And then as people start seeing that stuff gets fixed, then everybody comes to you for all of the things. Yeah. Other thoughts or? I mean, we're at time. It's almost like we planned it.
I think it's really great.
It's also really interesting doing wellness work as the quality safety person.
Yeah.
I feel like it,
No, but it's the role of
It's
us.
weird.
It's his challenge to achieve, because it's the first challenge, so it's.
it also shows how much trouble you can get yourself into. Like, you just keep doing it more and complaining loudly enough, then you just fix all of it.
But that's right, that's right.
Blessing.
That's right. We're doing this, this is in, debrief software, we code on it for,
Mm-hmm.
but they haven't, yeah.
I can send you all these things.
Patient safety, but then when the wellness people at the hospital were trying to be like,
everywhere, and we've trained a lot of people, and mostly they like self-select into doing it. That's how you either can into it or you just leave. And a lot of our sim people do clinical event debriefing because they like naturally like it and have kind of a backbone for it. For inpatient codes, we've actually trained our pulmonary care fellows, and they do it all, field of workshop,